My name is Erin Keyes. I'm the Director of Enterprise Operations for GoHealth Urgent Care, a national joint venture urgent care company with locations on the West Coast, East Coast, Midwest, Southeast, and growing. I initially started at GoHealth within our IT function, but as the ecosystem surrounding the delivery of urgent care medicine evolves, I now sit at the intersection of implementation, innovation, best practice development, and policy, or simply put, operations. Effectively, my goal is to make the lives of our providers and staff as wonderful as possible so that we may deliver unparalleled care to each and every patient that walks through our doors. With a background in masters in public health and business, the urgent care model was of particular interest to me. With a wealth of opportunities to serve patients of dynamic backgrounds, inclusive of patients who are insured, uninsured, established, new, and geographically diverse, I view the role of urgent care as the touch point between our medical system and the every person. Urgent care is uniquely positioned to serve our nation during a time of turmoil and development for our healthcare system, a time when, through pandemics, policy reform, leadership and infrastructure change, developing technology, and ever changes in health outcomes, we really do seek to extend a radius and continuum of care to those within our local and global communities. Particularly as an arm of joint venture partnerships with leading healthcare systems across the nation, GoHealth Urgent Care affords our patients access to targeted, personalized, and excellent care. Through my time at GoHealth Urgent Care, I've worked to implement clinical quality programs that address population health gaps in care across the nation. I've launched virtual visit service lines across 10 states and collaborated with some of the most brilliant minds on creative ways to direct care pathways to essential workers during COVID-19, to uninsured patients who need specific health services, to companies that seek to protect their workers and create a safe environment, and to patients uncertain or scared of where to go within the healthcare system. By lowering the barrier to entry to the health system, GoHealth Urgent Care intentionally seeks to increase access to quality care for all. But our work is nowhere near done. Urgent care has the potential to expand scopes of services for on-demand needs, further supporting load distribution for on-demand specialties. And by examining staffing pipelines, skill and resource development, and deep expansion of our IT and data tools, we can safely and effectively drive infectious disease prevention and response, or chronic disease management. We can increase accuracy of patient diagnosis and care pathway development, and streamline our patient experience. Through partnership and geographic expansion, we can bring these services to better fit across the urban-rural continuum, improving our understanding of health needs and issues of differing communities, and tailoring our care through iterative model development. For these reasons, I am honored to earn your vote for the Urgent Care Association Board of Directors. With this position, I hope to influence the utilization and regulation of IT tools. I hope to learn more about the diversity of health issues that face our nation and how we can support the improvement of health outcomes as a united organization and individual practices or companies. I will work hard to add clarity, prioritize resources, and enable each of us to serve our populations with clinical decisions at front of mind. Thank you to each of you for your contributions and wisdom in developing this growing, dynamic, and very important field of medicine.